Well, hi, good morning. My name is Wesley Epplin. I use he, him pronouns. I serve as Director of Health Equity at Health and Medicine Policy Research Group. I'm also with the Collaborative for Health Equity Cook County. Thank you to the members of the press and our audience for joining today's press conference about health workers and organizations standing with community members to demand that Mayor Lori Lightfoot and Commissioner of the Chicago Department of Public Health deny the permit for the general iron polluter relocation to the southeast side. We have 4 speakers today, and after each of them has shared their prepared remarks, we will open this conversation up with them and a few other expert panelists for questions and answers from the media. We will ask members of the press to put their questions into the Q&A box within Zoom. We will send the letter that we sent yesterday to city officials following the press conference to everyone who registered for the press conference. With that, I would like to ask our first speaker, Breanna Bertacchi, a recent hunger striker and member of the United Neighbors for the 10th Ward, to share her statement.
Thank you. Can everyone hear me? Thank you. Let me just pull up my statement. I'm honored to be involved in this panel, so thank you to everyone who's in attendance. All right, my name is Breanna. I'm a member of United Neighbors of the 10th Ward. I reside in South Chicago, and I just completed the 30-day hunger strike with my peers. I am exhausted, and I'm still concerned with the ethical dilemma this permit poses that Dr. Arwady seems able to ignore. A common rallying statement from this campaign has been, if it wasn't good enough for Lincoln Park, why is it good enough for the southeast side? We know the insidious and racist answer to this question, and we know the cognitive dissonance that must be required of both Lightfoot and Dr. Arwady to refuse to acknowledge or validate our demands for justice and clean air. I work in clinical research. I think many of the MDs on this call are likely familiar with consenting requirements for patients to be involved in anything greater than minimal risk. So let's take a genetic study. It's gonna just take a PAX gene tube. For that, the patient's gotta be provided with a consent form for written consent, as verbal consent won't suffice. If the patient doesn't speak at a 7th grade English level, then the consent form must be translated. The patient's given the opportunity to ask any and all questions they may have regarding potential risks, risk-benefit ratio, and they must know they have the right to withdraw consent at any time. That's for a blood draw. That's the biggest risk you face with that is infection at the needle site. We're talking about intergenerational effects of continuous air pollution, release of particles that are known carcinogens. We already know that the 10th Ward is heavily overburdened with many industrial sites, including but not limited to 8 landfills, many of which are toxic, existing operations of 3 out of the top 5 air polluting companies in the US, and disproportionately higher volumes of truck traffic, which cause further air pollution, noise pollution, damage to our infrastructure and roads. To date, around 2,000 published articles have been validated in only the last 10 years that detail various developmental, respiratory, carcinogenic, and quality of life effects that continuous air pollution have on communities. In 2015, a meta-analysis linked ongoing air pollution to 12 separate respiratory issues, high blood pressure, and oxidative stress, all of which are more threatening to the elderly and youth. In 2014, the NCI revealed that 35 separate compounds released by diesel alone are now known carcinogens. So not only is the operation of RMG itself worrisome, but just the truck traffic coming in and out of their facility is worth concern. So let's break this down as if it were a research trial. That's how I've approached it. The information regarding this permit was highly inaccessible. The city approved the construction permit for RMG with no notice to residents. Only when the operating permit went up for review did the city open up a public comment session. At that time, 16 organizations and hundreds of individuals raised their concerns and asked questions. I believe the city's timeline to respond to public comment has passed. I think it was sometime last week. Forgive me if I'm wrong. So we raised our voices, we asked our questions. We did so in the structures that the city had laid out for us, and we haven't received a formal response. The information was also not presented in a bilingual fashion. We recognize the city's propensity to provide resources in mostly English. There was no translator at the city hall, at the city council call. There was no ASL interpreter. and the online documents pertaining to this permit itself were in highly technical language. For a ward with 63% of constituents reporting Hispanic background, I'm wondering if I'm not completely out of line suggesting that the lack of bilingual resources may have been intentional. Regarding the risk-benefit ratio, again, the city provides no platform for this information to be shared. It's been the responsibility of community-based stakeholders to educate us on the medical burdens placed on this ward, how General Iron would substantially increase this burden as well. 10th Ward residents know better than to trust CDPH with their best interest in mind, as existing health disparities such as asthma development and cancer rates far surpass city averages, with rates of 11.6 and 49.8 respectively compared to the city average. That's from a 2017 air quality study. Additionally, there's no benefit to this company operating in our ward. The singular justification that I could have anticipated would have been if jobs were opened up to the neighborhood. And that one small benefit isn't even present here. RMG has clarified their intent is to rehire existing employees from the Lincoln Park location. That's despite statistics revealing that unemployment rates were among some of the highest in the city in the 10th ward during the peak of COVID. And lastly, this community, they can't withdraw consent at any time. These aren't families that can easily relocate to higher income neighborhoods that have their air quality protected. They can't avoid these medical impacts. These are families that have many generations of history in this neighborhood. These are families that built this city through years of labor at the steel mills. These are families that have every right to be proud of their neighborhood, but face the reality that the remainder of the city and the administration see it still as a dumping ground. In summary, if I treated my research patients' health and wellness and any similarity to how the city has treated the 10th ward, I have reason to believe I would be terminated. That brings us to Healthy Chicago 2025 initiative. The first theme in this initiative states that they will transform policies and processes to foster anti-racist multicultural systems. They claim that their priority populations will include, and this is the full list, Black and Latinx Chicagoans, low-income Chicagoans, communities disproportionately burdened by pollution, disinvested and gentrifying communities. I'm still in awe that CDPH can, on the one hand, take this initiative as a way to acknowledge a racist history of permitting and redlining in the city, and at the exact same time, turn around and continue to uphold those racist permitting procedures by seeing absolutely no problem with placing RMG less than a mile from a learning institution. Dr. Arwady is an MD with degrees from Harvard, Columbia, and Yale, has access to all of this information. This isn't news to her or her team. Her decision to disregard it in tandem with Lightfoot's decision to refuse acknowledgement of our valid concerns exposes to us a continuously insidious and racist pattern. The administration gets to access the privilege of presenting on this progressive platform, such as Healthy Chicago 2025. But when the time comes to genuinely uproot those racist permitting structures, nobody in the administrative office of the city is willing to actually do that work. I was asked to contribute to this panel today, and I'm honored to have seen so many health professionals taking a stance on this issue. It's difficult to acknowledge that at this point, this step has become necessary. Working with health professionals in this manner shows exactly how dire the situation is becoming every day. This word is simply asking for the same air quality that other Chicagoans are granted. I know every day it must be harder for the city's administration and CDPH to ignore and invalidate the logic in our arguments. And so I'm delighted to have seen so many health providers using their expertise in this way to support our struggle. So thank you for having me on this panel. I'm honored to be here. Thank you.
Thank you so much, Breanna, for your words and your work over the last several weeks and your dedication and commitment to your community and to public health. Next, I want to announce our next speaker, Dr. Stephen Rothschild.
Good morning. Thank you, Wesley. My name is Dr. Steve Rothschild. I have been a family physician on the West Side for over 30 years and have lived in this city most of my life. I am also proud to serve on the Chicago Board of Health, which is the volunteer professional advisory body to the Department of Public Health. Today, though, I appear as president of the Health and Medicine Policy Research Group on behalf of our board and our staff. For 40 years, Health and Medicine has been working to improve the health of all people in Illinois by promoting health equity. Equity, health justice, anti-racism, health promotion, these are not just high-minded phrases for us. They are the lens through which we evaluate policies and actions and their impact on the people of this city. We are therefore disturbed by the city's decision to facilitate the relocation of General Iron from its Lincoln Park location to Chicago's southeast side in what can only be described as a textbook example of environmental racism. This is an area that has already got high levels of air pollution and which CDPH itself has advised be prioritized for efforts to mitigate and reduce air pollution. As has already been noted, asthma, heart disease, and cancer are linked to that air pollution. A 2017 study looked at air quality downwind of metal recyclers like General Iron and found measurable levels of iron, manganese, copper, chromium, nickel, lead, cobalt, cadmium, and mercury in the air. And there was an estimate that the carcinogenic risk associated with being downwind of such a facility could be as high as 6 in 10,000. Data from the Chicago Department of Public Health shows that the southeast side is already overburdened. And in fact, the department has been working for several years to mitigate high rates of manganese pollutants already in that community. So turning around and granting a permit to General Iron would undermine that public health work and would worsen the situation for the community and cause the kind of problems that physicians like myself see every day working on the front line. We could reasonably raise a question as to whether an industrial process like this metal recycling should be located near any living creature, let alone next to residential communities and schools. But it doesn't take an epidemiologist or an environmental engineer to figure out that placing this toxic plant in a community that's already overburdened by pollution will further exacerbate health inequities in our city. The proposed southeast side location is primarily a Black and Latinx community of workers who for over a century have toiled in foundries, steel mills, oil refineries, and produced wealth for this region and for the municipality. Today, these Chicagoans live literally on top of trash heaps of these industrial operations. It is a community that's shortchanged on power, shortchanged on resources. It's a community of color, and it bears an excess burden of deaths from preventable illnesses. As already alluded to, the city's 5-year community health plan, Healthy Chicago 2025, acknowledges these inequities, and it describes a goal of reducing the life expectancy gap between Black and white Chicagoans. In the plan that everybody can read online, CDPH states that the people most affected by inequities must have the power to shape the policies. Well, the people on the southeast side, like Ms. Bertacchi, have spoken clearly, and they have said that General Iron should not be located in their community. Hundreds of health professionals like myself agree with them, and we call on the city to live up to our own stated goals and the standards that we as a city set forth in our plans for environmental justice. You can't just use the words equity and then do something that runs entirely counter to that work. That is hypocrisy, that is racism, and it is something that we can no longer abide as citizens of the city of Chicago. Health and Medicine Policy Research Group is proud to join with over 70 other organizations, along with hundreds of individuals and health professionals, major newspaper editorial boards, environmental health experts, and national public health leaders to call on the Chicago Department of Public Health and Mayor Lightfoot to deny the permit. Thank you.
Thank you, Dr. Rothschild. Next, our next speaker is Chloe Gurin-Sands from Metropolitan Planning Council. Chloe.
Good morning, all, and thank you again to Breanna and all of the other hunger strikers for your work. My name is Chloe Gurin-Sands. I'm a manager of health equity and planning at the Metropolitan Planning Council. I also serve as one of the co-chairs for the Partnership of Healthy Chicago, which is a multi-sector group of public health stakeholders that works with the Chicago Department of Public Health on the development and implementation of Healthy Chicago 2025. As a leading member of the partnership, MPC stands with the communities demanding clean air and urges CDPH and Mayor Lightfoot to deny the G3 permit request and take immediate steps towards fulfilling the environmental justice commitments in Healthy Chicago 2025 and the 2020 Air Quality and Health Report. Allowing the relocation and operation of General Iron's facility will place another source of environmental pollutants in a mostly Latino and Black community already burdened by serious health threats, continuing an unjust pattern of environmental racism and undermining our future aspirations for economically and environmentally sound planning across Chicago. It is the legal duty of the CDPH to enforce environmental rules and protect the public's health and safety. Approval of the permit is in direct opposition to the City of Chicago's own public health strategy. Healthy Chicago 2025 puts forth the main goals of moving toward racial equity and reversing the decline in life expectancy of Chicago's Black and Brown populations. The strategies for achieving these goals include improving air quality, reducing exposure to pollution, and evaluating the cumulative impacts of pollution. As such, MPC urges the city to deny this permit and immediately begin the steps outlined in the air quality report, including evaluating the enforcement, inspection, and permitting process with an eye towards reform, and developing more stringent permitting requirements to prevent cumulative burdens from disproportionately affecting certain neighborhoods. Most importantly, community experts must be at the forefront of evaluation and reform, and CDPH should make good use of the community-led research that is now available in the Calumet Connect data book, which contains critical data for understanding the impact of the industrial corridor and is informing the upcoming Calumet Industrial Corridor modernization process. Mayor Lightfoot and Commissioner Arwady denied the permit to advance public health, racial equity, and environmental justice in Chicago. Thank you.
Thank you so much, Chloe, and hello to your little one. Next, we have Dr. Linda Rae Murray, past president of the American Public Health Association, to share her remarks.
Good morning. Almost 30 years ago, the first National People of Color Environmental Leadership Summit, held in October in 1991 in Washington, D.C., adopted principles of environmental justice. In the words of the summit, the principles were designed to, quote, ensure environmental justice, to promote economic alternatives that would contribute to the development of environmentally safe livelihoods, and to secure our political, economic, and cultural liberation that has been denied for over 500 years of colonization and oppression, resulting in the poisoning of our communities and land and the genocide of our peoples, unquote. A decision by the city to grant a permit to relocate the General Iron Reserve Management Group would represent a violation of these principles. The decision to grant the permit violates Mayor Lightfoot's commitment to equity and violates the commitment on the part of the Chicago Department of Health to fight racism. Granting this permit will make an already unacceptable inequities of environmental burden even worse. Centuries of industrial pollution are enough. The solution is clear: deny the permit. Our city, region, nation, and world have come to a critical decision point. We must decide in favor of saving the planet and the lives of Chicagoans, even on the Southeast side. As a national public health leader and an expert in environmental and occupational health, I am proud to stand in solidarity with my colleagues and neighbors in demanding that the permit be denied. Thank you.
Great, thank you to all of our speakers. We now will go to Q&A, and we have as much time as we need. So members of the press especially, please put your questions into the Q&A box and we will address them. Let us know if you want to address it to one person, or otherwise we can ask our panelists to, we can direct the question to the panelists. Okay. I see a question in the Q&A. For Dr. Rothschild, does the Chicago Board of Health have any power to instruct or convince CDPH to deny the permit?
Thanks. The board is essentially an advisory body to the commissioner and the department. This will be discussed at the next Board of Health meeting, which is a week from tomorrow, which is an open meeting so that people can register and attend via Zoom or WebEx, I believe is the platform. We have no voting authority, but we are able to raise questions on behalf of the public about this topic.
Okay, we have another question here. Now that the hunger strike is over, what is next for putting pressure on Mayor Lightfoot's administration? This comes from Amy Quinn. Amy Quinn.
Sure. So I can speak to that. I recognize that many community organizations located on the southeast side and many statewide environmental justice organizations as well have been partnering with us to establish next steps of escalation. So we do want to recognize that although the hunger strike is over, that historically we've seen within the city of Chicago that hunger strikes have lasting impact, particularly with the Diet High School hunger strike, in which their demands were met after the hunger strike had terminated. So we do intend to continue to escalate this. We're glad to be seeing that media and press coverage continued despite the hunger strike being over. That's part of what our hopes were, to continue to raise awareness into this, make sure that the city knows that they can't do this behind a cover. So we do intend to continue escalating. I can't speak necessarily right now on behalf of our organizations in terms of what comes next, but we're not finished. So I hope that answers the question as best I can.
Thank you, Breanna. There's another question in the chat also for Breanna. What is your call to action for medical and public health professionals across the city and nation to support reform necessary to support environmental justice communities like the Southeast Side? That comes from Yesenia Chavez.
Sure, that's a great question. I think it is important to have platforms like this to voice that with medical licensure comes an obligation to protect disadvantaged communities. And knowing that the petitions have been circulated to garner as much support as has been brought up in this press conference is a step in that right direction. I think as public health officials and as anyone holding an MD and anyone attending, these are common sense elements of holding that degree. I think we all understand the toxic effects that air pollution, continuous ongoing noise, things like that, especially in youth populations, what types of lasting effects those can have. So I think it's important right now in this particular instance also to highlight how close this is to a school. So we see many behavioral effects and changes occurring when noise pollution is regular and intermittent in educational facilities. So if you have trucks banging down the street while you're in math class, you know, what is the likelihood that kid's going to pass an SAT with pertaining to math or something like that? So there are the studies out there to link noise pollution and air pollution to behavioral outcomes in youth. So I would encourage as many people as have been on this call here that are in support, that are signing petitions, to continue listening to your environmental justice communities, to continue uplifting the voices of those spaces that historically are seeing policies not serving and protecting them, that are protecting predominantly white or upper income communities, and listen to those EJ communities, hear their demands, understand, learn from the community stakeholders that have been educating us, the community members, for years. There are legends in this community that have now published work and has also previously have had published work, and those voices need to be uplifted. So I'm encouraged to see that this platform doing so and continue to show up in this way, uplifting those voices. Thank you.
Thank you. I have a question for, we have a couple of our panelists have worked within public health, within local health departments. So this is a question, I guess I'll pitch it to Dr. Murray and Jim Bloyd. What do you see as the role of a public health plan like Healthy Chicago 2025? And what is the role of the health department in following that plan? What is their responsibility with regard to, well, first of all, share for the audience what those public health plans are, because many may not know, and what the duty of the health departments is with regard to those plans and this issue of environmental justice.
I'm deferring to Mr. Bloyd.
Thank you, Dr. Murray, my friend and colleague, Linda. I appreciate that question, Wesley. The purpose of the plannings, the strategic plan, in this case, we're referring to the Healthy Chicago 2025 plan, is to be a significant part of meeting the requirements for every certified local public health department in the state of Illinois under the Illinois Code, and we refer to it as I-Plan. So all certified local public health departments must have a strategic plan with significant, meaningful engagement with community members, have measurable objectives, and meet a host of detailed measurements and standards. And so in this case, the Healthy Chicago 2025 plan really is an ambitious, very, very good plan, which emphasizes ending oppression, fighting racism, and as Breanna Bertacchi, one of the brave hunger strikers, which frankly, I want to say I'm humbled to be included as an ally with the movement to stop General Iron. But that this plan is good, and many of us on this call and many of my friends and colleagues in my 30 years of working in local public health have contributed to that plan. And so in this case, I echo what some of the speakers have already said, that this will constitute a gross betrayal of the Healthy Chicago 2025 plan. Frankly, it shocks my conscience. And I think the outpouring of over 500 signers and over 70 organizations, including national organizations and highly recognized national individuals, including Nancy Krieger from Harvard University, Brian Smedley, who is one of the co-founders or leaders of the National Collaborative for Health Equity, as well as the local leaders who are joining us today on the call, shows that it really must be revised, this decision. But the plan is crucial, and it's a basic part of doing good public health in the United States.
I would encourage all the listeners and all of us to hopefully have learned something in this past 12 months of battling a global pandemic. Many of the debates that we're talking about, the regulatory process for granting permits usually goes on sort of underneath the covers and it's handled in a bureaucratic way. And I would argue that any physician, any public health professional, nursing, any community person, we need to put a stop to this sort of business as usual. We should have learned something from the present COVID-19 pandemic that we're facing, and the time has come to put our values, the values we say we care about, front and center. And so I would argue that it is a process of basic good practice as a public health professional to state clearly, does the siting of this plant to the southeast side of Chicago help or hurt the health of the people? The answer is clear. We don't have to worry about all the little technical details. Anybody could see that this hurts the health of that community and the broader community. So I think the time has come for all of us, if we're understood what happened January 6th in our capital, if we understood what happened last year with George Floyd and all of these demonstrations, we have to stand up as ordinary human beings of the world and say, we need to stop this process of putting people's lives, sacrificing them on the altar of some companies making profit. That's something the city has to do and the health department has to do. So I'm calling on my colleagues to stand up and do what you know is right.
Thank you, Dr. Murray, and thank you, Jim Bloyd, for your answer to that question. Here's another question I've been wondering if I might ask of Chloe Gurin-Sands from Metropolitan Planning Council. Chloe, as she shared, is the community co-chair of the Partnership for Healthy Chicago. At Metropolitan Planning Council, she also has done some work and writing on this issue of industrial zones. Chloe, I'm wondering if you could share for the audience the kind of your analysis of the situation of inequity related to the zoning process and the city's look at rezoning in the city.
Sure, thanks, Wesley. So I don't know, folks may or may not know that the city is currently undergoing a process where they are looking at all 26 of Chicago's industrial corridors and really are doing that with an eye towards trying to align what the zoning and current uses of those are with, the new trends that are happening across the city. So as part of that effort, folks like the Calumet Connect, who have been working on this data book, really are pushing for the city to continue to expand the types of data and considerations that they're taking when they're making decisions about how to zone things, and to really take a comprehensive look at how changes in one area affect what moves to another area. So in the case of General Iron, some changes in north side industrial corridors, we're seeing that put more pressure on the corridors in the south side, where industries that are being zoned out of other areas need to move. So we really are just advocating for a comprehensive look, really trying to understand, how things across the city affect each other and taking into account what the environmental justice data is saying especially in these communities where we know that they're already burdened while we're making those zoning decisions.
Thank you so much, Chloe. I'm wondering, we have several healthcare providers on our panel, Dr. Murray, Dr. Rothschild, Dr. Rogers. I'm wondering if you could share any insights on what you see on the front line. Let's focus on asthma patients, and if you could share the relationship between community conditions, like whether or not a community is overburdened by pollution, and the kinds of health conditions that you see in the clinical setting.
I can start. I mean, because I'm going to, I think as a family physician, I take care of kids as well as adults. And asthma is one of the major causes of avoidable absenteeism in our schools. So when we look at pollution, and then we think about worsened asthma, for which it's a trigger, for which it means school absenteeism, which means lost learning opportunities, this becomes a problem which has multi-generational impact, right? It's not just our emergency rooms where we see higher rates of asthma on the south and west sides, where we see, greater absenteeism, but this is a multi-generational impact. So when you go, we can put General Iron in this community, and those children in that community, well, they'll just hit their inhalers harder. This goes, into the deep meaning of health, which is the opportunity to live full lives, maximizing our opportunities. And so when we place a General Iron in those communities, we say to those children, your health, your education doesn't matter, and your futures don't matter.
I just wanted to actually ask a question to just see if a lot of these evidences of environmental racism we're all aware of. There are some that are more local, like this one that we're talking about today. There are others that are more nationally known, like Flint, Michigan, and their water. But I wonder if there should be some sort of federal oversight that really can impact how we address these inequities, because it's almost like grains of rice. There's millions of them out there, and that we can be very passionate about what's in our backyard. But then these companies just have to go 5 miles into another county, and they're beyond the effects of our social activism to address this. And I don't know if there should be some sort of federal movement or federal oversight, not that the federal government has solved all our problems, but whether that may be a way to address this so that things aren't hidden.
I think that Dr. Rogers raises a critical point. And I want to remind people, as I try to do in my statement, that this is a battle that's been going on for decades. Under President Clinton, the environmental justice movement forced presidential executive order requiring at that point in time all elements, all departments of the federal government to justify these kinds of permitting processes and other decisions to make sure that it improved environmental justice and did not harm environmental justice. I want to remind Chicagoans that I'm proud to be from the city, because Hazel Johnson, who is now deceased, coming as a leader out of Ottgale Gardens, is really one of the mothers of the environmental justice movement in the United States. And her organization still continues today. I think this point that Dr. Rogers brings up is a basic point of democracy. We should use every lever that we have, not just the federal government, but also state, county, and local government. But it means that ordinary people that live in our country have to be willing to stand up and speak and fight for what we know is right and fight for what's important. So, for example, I will say this in terms of public health. I was distressed that there's going to be new city ordinances that clearly codify that the Chicago Board of Health has only advisory authority. That wasn't always the case. So we should be asking ourselves, when we're trying to gain control over our police departments, we're trying to gain control over our school systems, our public health systems is also another area where we actually need to be able to have a public voice and to make sure that we have input into these decisions.
Wesley?
Sure.
I
Yes.
might just like to interject, as Linda referred to input on these decisions. The Collaborative for Health Equity Cook County, together with the Health and Medicine Policy Research Group, the two organizers of this letter, which has received such strong support from the health community, has indeed requested to meet with Commissioner Allison Arwady. And we have asked her for her available times next week. And so we look forward to talking with her and persuading with her on the topic of democracy, that core public health values, meaning that it include that Chicago Department of Public Health needs to act in the manner that benefits the entire population it serves and the residents whose taxes support Dr. Arwady's position, not just those who appointed her. And that's a crucial point, I think, of democracy and a core value of public health. So we look forward to updating the public about Dr. Arwady's response to our request to meet with her.
Thank you for that, Jim. We haven't heard yet from all of our panelists. I want to invite Kelly Nichols from the Respiratory Health Association to share your perspective on air pollution as it relates to lung health in Chicago.
Hi. Yeah, I mean, as everyone has already said, as all of the medical professionals have already said, we have all the evidence that anyone could ever hope to want to support the idea that lung health is impacted by even small amounts of pollution. I remember a study just came out a week or two ago where they did a study on Medicare recipients that even at low levels, pollution can have long-term lasting effects on health and public health. And I think that that's something that everyone has really underlined. And what I always hope when we get in a situation where we're all in a space where we can communicate this idea out is that we need to get to the point where we have our information coming from the public health sector and the medical health sector, and really translating that information in a way that makes people want to listen at the level of policy change, right? Because this information is repeated over and over and over and over and over, right? And it's the point where you wave your arms and you say, you hope that it's not by design that people aren't listening the way they need to listen to protect public health, but you have to keep making people aware that lung health, especially people who are already vulnerable, there are high rates of COPD and asthma in the region that they want to move general iron to. There's high rates of some certain cancers that are impacted by some of the things that may or may not be exuded by the relocation of this facility. And it feels like that's enough evidence to make sure that the permit is denied. And I think that making sure that people have a forum where they can continue to share that information to the people that make the decisions is critical. But at some point, everybody has the information they need. So the decision has to be made to protect the people that need to be protected.
Thank you so much for that, Kelly. Really appreciate your perspective on this. We have a comment in the Q&A from Yesenia Chavez, who was a hunger striker. I wonder, Yesenia, well, maybe I'll just read your statement here. So she says, I was also a hunger striker for 25 days, but just wanted to thank everyone from the bottom of my heart for this panel and raising awareness of our Stop General Iron campaign. As a lifelong Southeast Sider, I have lived through the trauma of a silenced and politically abused community dumped on by dirty industry. It hurts witnessing people downtown get to enjoy the riverfront, and we don't even have access to our river because it's so toxic. So again, thank you for giving us a voice. Yesenia, I don't want to put you on the spot, but we promote you to panelists to share a few words if you're willing. Could you raise your hand if you're willing to do that? And if not, no pressure. The raise the hand is at the bottom if you're having trouble finding that. If not, again, no pressure if you're not willing at the moment. Oh, we have another, let's see, in the Q&A. Okay, so she says she's in lecture for anatomy. So thank you for joining us. Really appreciate that. And for sharing your words and for engaging in true sacrifice for public health and for the health of your community. We're coming up on closing out. I'm wondering, just to open it up for our panel, so are there things that you wanted to say that you didn't get a chance to share with our audience today? Maybe I'll just go one by one. Jim?
I just want to point out that one of my public health colleagues who I idealize is Dr. Kamara Jones, who's organized against racism at a national level as a past president of the American Public Health Association and as a physician. And I think the behavior and the choices made at the moment now by the city and particularly Dr. Arwady and the Chicago Department of Public Health fits one of Dr. Jones's definitions of structural racism, which is devaluing Black and brown lives. Structural racism is not valuing all lives equally. And this is a simple case of devaluing residents of the Southeast Side lives who are Black and brown. And that's completely unacceptable.
Thank you, Jim. Next on my screen is Dr. Susan Rogers.
Oh my, I wasn't expecting this, but I think, as president of Physicians for National Health Program, I think the the underlying inequities in access to healthcare are made even worse by creating more health issues in certain communities. It's difficult to get treatment for the issues that everyone faces, let alone for those that are purposely perpetrated in those neighborhoods. So I think one of the things that we really have to strongly address is getting access to care for everyone, regardless of where they live and regardless of their financial status, their insurance status. And although it will not eliminate these things that are done to poison communities, we need to at least have access to care for everyone. And that's vital if we want any kind of social equity in this country.
Thank you, Dr. Rogers. Next on my screen is Dr. Stephen Rothschild.
We often say that, you know, everything is connected with health. And, you know, in this case, what may seem like a real estate decision, an industrial decision, impacts the health of a community. And it does so in a way that further impoverishes, further traumatizes, further destroys the lives of the people in that community. And, you know, what the only antidote for that is for communities and their allies seizing power, is taking, you know, organized action such as this. The work, you know, of the hunger strikers to elevate this issue, and their courage is amazing. I'm hoping that others have seen that work, are aware of the struggle, have heard the conversation today, and will step up, because I don't believe that our leadership is willingly, you know, racist. They would go, no, not us. But we have to keep saying, but this action is. So if this is the wrong thing, do the right thing. Stop this permit.
Thank you, Dr. Rothschild. Next, Kelly Nichols.
I think I said pretty much everything I need to say, but we have all the information, in my opinion, and our organization has said as much in letters publicly and in the work that we've done with the General Iron Campaign. And even for me as a human being, I've worked on the Southeast side in campaigns from manganese and on. And I think that we have the information, we know what we need to do, and we know we need to deny the permit to help not only protect the community, but set the precedent that this kind of treatment is unacceptable. So thank you.
Thank you, Kelly. Dr. Murray.
Well, I want to thank everybody for coming. I certainly agree with all the remarks that have been said. I hope that all of us have learned from this past year that in order for us to be healthy as a world, it means we have to keep track of each other, look each other in the eye, hear each other, and support each other's right to exist. And what that means is we have to be willing to challenge the underlying assumptions. So just because General Iron may be able to make a profit off of this doesn't mean that that helps Chicago or anyone else in the world. We have to be willing to stand up and demand significant changes in the underlying structures of this country. That's what structural racism is about, so that the default position is one that supports health, that supports people, that supports justice. So I look forward to continuing to work on this issue. And as Dr. Rogers pointed out, so many other issues that are critical. And when we can connect these issues together, our strength grows and our power becomes greater.
Thank you, Dr. Murray. Next, we have Joanna Tess.
Thank you, Wesley. I'm honored to be here with you all, especially Breanna and the others who have organized for much longer than we have. I'm a concerned Chicagoan, a public health practitioner, and as others have noted, this is a textbook case of environmental racism, and there is a discrepancy between our words in public health and our actions. So we are calling for accountability, in healthcare and in public health, and for our decision makers to listen to the community. And I look forward to continuing to hold our officials accountable, because this isn't the last time, and we need to assess what is going on and the powers that are at play to really make a change moving forward. And I look forward to that work. Thank you.
Thank you, Joanna. Next, we'll have ask Susan Avila.
I certainly echo and support all that has been said before me, and to say a huge thank you for the Southeast Side that has a long, wonderful history of fighting not only for their community, but for the Chicago and for our neighborhoods. Thank you so much.
Thank you, Susan. Next, Chloe gurin-sands. Not sure if Chloe's still there. Chloe.
Sorry, baby's running away.
That's all right. I hope it's all right. Okay, we're gonna go to ask Breanna.
Thank you. As much of a struggle as the last month was, it's spaces like this that feels like it could be worth it. We haven't seen the denial of the permit yet, but knowing that that drastic action raised so much attention to this struggle helps me feel recovered a little bit. I do appreciate the points that have been raised here as we're closing. I do agree that this is a step towards holding our officials accountable. These are positions that are held by tax dollars, and that this is a clear instance where that money isn't being used in service of our interests, and that's difficult to swallow and deserves accountability from, and this is a step in that process. So I'm enormously humbled by the professionals that have chosen to use their platform to speak out against this. I do also, without having any statistics, I just want to point out that air travels this is condensed and consolidated on the Southeast side, and also on extremely hot days in the summer. We know the whole city has air quality advisories. So we saw with the Hilco incident during COVID as well, that impacted many communities. That wasn't just restricted to a 12-block radius around the facility. That matter traveled, and it will. So, maybe as much as the city wants to think this is a them problem and it's an us, them being the Southeast side problem, it is genetically still a citywide, a nationwide problem. So I agree with the point that was raised previously that there should be some federal standard for how close these industries can be to residential, business, commercial, parks and outdoor spaces. That needs to be protected. So, but we are seeing with many statistics that the city chooses to acknowledge, but then disregard that the Southeast side is disproportionately affected. And so spaces like this to share that education around it and find some type of corrective action, something that I'm honored to be a part of. So thank you for this panel. Thank you all for your time.
Thank you so much, Breanna. Next, we have Chloe. So Chloe, the question was basically if there was anything that you'd like to add that you didn't get to share before with the audience.
Got it. Thank you. And sorry, everyone, my kid was running away, so I did not hear the question the first time around. But no, just echoing the gratitude that other folks have shared, especially from community experts that have been pushing these issues for decades. And it's taking our community public health, community probably longer than it should for us to fully put our weight behind it. But just reiterating the importance of continuing to bring the environmental justice data and perspective into all planning efforts across the city, and understanding the interconnectedness of all of the decisions that we make on every level.
Thank you, Chloe, and thank you to all of our panelists today, and thank you again to the hunger strikers and other community members who have led, as people have shared, for a very long time, and for who really stepped up and put their health on the line and sacrifice really for the demand for clean air, for their health, and for environmental justice. And I just want to underscore that it shouldn't take that, right? That they shouldn't have to do that. No community should have to go to that extent. And I think that one other thing I want to share is here in the Q&A is from Marcelina Pedraza. Says, "Thank you all for your support. I hope the city will listen to you, since they've all but ignored us who live here and deal with us on a daily basis." So thank you, Marcelina, for that comment. And again, this is not acceptable public health practice to ignore community members demanding their right to health, their right to clean air, and the right to environmental justice. So thank you for sharing that, and thank you for being here. I want to close. We stand in solidarity with community members who are demanding their rights, their health rights and environmental justice rights. I want to close with a few words and that we want to hold the Department of Public Health accountable to. So they hosted a forum. I was in attendance along with, I think, a couple hundred community members and public health professionals. And it was focused on root causes of health inequities. And in their symposium report, it says what we learned, our framework for action, and it has several bullet points. I'm going to read one of them. It says that they will be guided, their future plans for public health will be guided by these principles. One of them is to, quote, advocate for equity. The public health system can influence policy, systems, and environmental changes that will address structural racism. It is our responsibility to promote resources and investments in communities most affected by inequities, and to help build capacity so community members can advocate directly for local priorities. And I just think that we ought to hold our public officials, the health department, Mayor Lori Lightfoot, Commissioner Dr. Allison Arwady, responsible for the health of the public, responsible for anti-racist governance, and responsible for their words and commitments in their public health plans. And so I want to thank everybody for joining us today on behalf of Health and Medicine Policy Research Group, on behalf of the Collaborative for Health, the Collaborative for Health Equity Cook County. We really appreciate everybody's time today and commitment to this issue. We'll be sending out the letter following the event today. And again, thank you and have a good rest of the day.
Thank you, Wesley.